I'd like to call to order the work session for May 10th, 2021. We are not all present this evening. Councilmember Campbell will not be with us, so we'll just move on. All right. Will the city clerk please give the information on how to participate in tonight's meeting?
While the Goodyear City Council meetings are open to the public, the occupancy remains reduced to implement social distancing. Seating is generally available on a first-come basis. Face masks are required in the building until 5 p.m., and they are optional after 5 o'clock p.m. While work sessions do not have a public comment component, our residents still have several ways to address the council and may view meetings using Facebook or the live session link on the meeting video page on the city clerk's office website. Meetings are also available on YouTube, both live and after the meeting. The public may also always contact the mayor and council at any time by sending an email to gycouncil@goodyearaz.gov.
Thank you. We have one item on the agenda tonight, and of course, council, I'll remind you that staff will be pausing intermittently to answer questions. This item is a presentation on the Crisis Medical Response Vehicle Program for staff to receive input and direction on the response vehicle utilization. Paul Louisi, our fire chief, will present. Paul?
Good evening, Mayor and Council. I'm actually going to throw it over to our city manager, Julie Cairns, to kind of start us off tonight.
Thank you. I just, Mayor, wanted to give a brief introduction of this item. Last year, while attending the International City County Managers Association conference, I had learned about some compelling new trends in community interactions with our uniformed public safety folks and members of our community. And there was one presentation in particular out of Eugene, Oregon, and it was called CAHOOTS, all capital letters, CAHOOTS, and it stood for Crisis Assistance Helping Out on the Streets. And so I shared that presentation with the Goodyear team, and during my annual evaluation had proposed this concept, or looking at this concept for Goodyear as one of my proposed goals. And the goal was to study it and bring forth a proposal. Anyway, the team became so excited about the potential. And of course, just like when you're looking for a new car, once you have your sights on something, you start seeing it everywhere. And I really started to notice how much this was taking off in our nation and seeing kind of headline after headline. And so the team, with their excitement, realized that there was the potential to jump off of an existing program to bring this different type of service to our residents. And so wanted to bring it forward for council consideration, and clearly as part of the budget process sooner than I had anticipated. But tonight the chiefs will both be giving a presentation, a joint presentation on how this could look and feel here in our community.
Thank you for that briefing. You have the floor.
Good evening. Tonight, myself and the police chief, Santiago Rodriguez, will go over our crisis response program, and we'll certainly allow for time for questions, but we're ultimately seeking council input and direction tonight. So kind of our current state right now, for most behavioral health calls, there are kind of two fashions with how calls come in. So obviously through our police department and through our fire department. And so tonight, Chief Rodriguez will kind of give a little background on PD requests when they have to call out for a CR van.
Thank you, Paul. Good evening, Mayor and Council. So there are times that we call out the CR van, especially on large crime scenes or crime scenes that might need some help with additional services, not only for the victims, the families involved, but also for the children that may be involved or have witnessed it. And many times we'll reach out to see if there's a CR van available. Many times they're not available, or there's a major delay because they're either busy in other cities or they're stuck in a city where they respond to, but they don't just come this far out west. At that time, we either got to change gears and we have to assign people or call people in to help us with some of these crimes and some of these resources. So an example can be, we had a case where we ended up taking people over to the advocacy center because it's a little more laid back than at the police department, or just sitting outside on the curb or down the street. So, but it takes time, it takes employees, it takes people to come out. And sometimes you don't have that time, especially if you're still investigating a crime and you need all those resources to apprehend a suspect or to get to the next location. So there are times that we'll request the van multiple times, and they're either already busy in other cities or they're just not available to us.
And then for the fire department side, typically we can wait anywhere from 45 to 60 minutes when a CR van is available. So it is very difficult at times to get a CR van to come out to us. A lot of times we have to use our battalion chief to fill that role, which really is not their skill set, but they are obviously team players, and so typically we'll try to fill that role as best as possible. So here's kind of a breakdown of the calls over the last 3 fiscal years. And as you can see, there's certainly an increase in call volume on the fire side and a pretty steady call volume on the PD side. We certainly recognize that some of these calls may be similar or the same call, but it's sometimes very difficult to separate the 2 calls in our systems and the amount of time that we had to research these calls. So you can certainly see about 3 to 4% increase over the last few years of these call types. But I will note, now these are all call types that the CR van responds to. So multiple kind of different call types that they will respond to, which we'll talk a little bit more about in a few minutes. But I will say between 2019 and 2020, the largest increase was in behavioral health calls. And we saw about a 59% increase in those calls in that year. Here's some of the national models that are out there. As the city manager stated, the CAHOOTS program that's up in Oregon, but there's also other programs that are out there as well. Seattle, Washington has a Health One program, which is run by the fire department. Very similar setup to what we're going to propose tonight, a social worker and a firefighter. Portland, Oregon, same type of a setup. Behavioral Health Unit is the name of their program. It's run by the fire department. Again, it's kind of same setup. St. Petersburg, Florida is called the CALL program, which is actually run by the police department. They have an officer and a behavioral health specialist. Rockland County, New York, suburb of New York City, they have a behavioral health response team, which is actually run by their paramedic service out there. In Denver, Colorado, they have the Crisis Intervention Response Unit, which is run by the Sheriff's Department. Gainesville, Florida is a community resource program, which is run by the fire department. And then lastly is the Colorado Springs, Colorado. They have a community response team, and it's actually a 3-legged stool, if you would. It's police, fire, and a behavioral health specialist. So kind of a 3-person unit that would respond to those types of calls. So currently in our current system, in what our current resources are, is the CR van is a very limited response resource in the automatic aid system. It will respond to high stress incidents to assist families or find resources for patients in need. Typically staffed with a social worker and an EMT, and typically the EMT is a volunteer. There are actually only 9 CR vans in the system, and they are anticipating that Phoenix will add several more in the next fiscal year. Right now, they are talking about possibly increasing their numbers by 5. So the call types that they do respond to, typically behavioral health emergencies. They will respond to large fires where families are affected, high stress incidents, which include suicides, drownings, shootings, stabbings. Those types of calls will get a CR van response, an automatic response. And then also large scale accidents. Whether it's a motor vehicle accident or train or plane, something like that, we'll always get a crisis response out to that call if one is available. So the model that we actually looked at was the Tucson fire model. It's called the Tucson Collaborative Community Cares, kind of a tongue twister there, but they nicknamed it the TC3 program. Been very successful, has been up and operating since 2016. Most recently entered into a partnership with Tucson Medical Center that's really kind of helped that program quite a bit. Staff with a similar type program as you've heard on the national models and one that we'll propose tonight. It's with a social worker and a firefighter paramedic that staff the response unit in Tucson. Our concept that we are proposing tonight is a 2-person team of a firefighter, paramedic, and a licensed social worker. They would respond and be dispatched by the fire dispatch and we would also develop a workflow for our PD dispatchers, for our officers, and for our firefighters. So there would be an education push that would go out to all of our public safety personnel. They would work out of a passenger van or a Tahoe type vehicle, but that's kind of a typical platform for them in the system, is to operate out of a passenger van. Some of the call types that they would respond to on my left, you can see that the regional asset, the automatic aid asset, what they respond out to now is crisis counseling, grief and loss calls, resource connections, behavioral health emergencies, and then obviously those high stress incidents. Our proposal tonight would include all of those, but also add in treat and refer, which is a new program that's allowed by Access, or the Medicaid system in Arizona, community paramedicine, and also patient healthcare navigation. Now, we can set up in the system, we can set up what they would automatically be dispatched on. And certainly it would be those top calls. So the crisis counseling, grief and loss, resource connection, behavioral health or mental health emergencies, any type of crisis situation or high stress event would get an automatic dispatch from them. But that's something that we can set up in the system, and we can certainly change that at any point or add to that to ensure that we're serving our clients. Right now, the busiest days of the week for us, and we've been tracking this over the last few years, are Mondays and then Wednesday through Friday. And then our busiest hours of the week are 9 a.m. to 9 p.m. And we would really try to find a 10-hour period that kind of fits our needs the best. And then the vehicle can be assigned to Goodyear. So we could geofence their response area if that's what we so choose. Or we can make the area larger if we wanted to maybe provide services for Avondale. But we would really use that first year to really determine their effectiveness of that call, of their system. So we've taken a couple cracks at trying to name the unit. We did, what you may have seen in your packet, have seen the Goodyear Cares as an opportunity for us to name that. But we've been working over the last week to try to find a name that really suits what we were after, and we think we've certainly settled on the community response team. But I do want to take a pause here and just kind of get some feedback from council on the name and any ideas that you may have on that.
So comments on the first part of your presentation?
Yeah, or certainly more so the name, Mayor.
Thank you. Council? Laura?
I like community response over Goodyear Cares.
Joe?
Yeah, I agree. I like the community response team. Okay. Personally, a couple things for the operation, because you say right now you're calling on units that should be coming from Phoenix, et cetera, correct? If we limit this to just our area, would that limit you not having the ability to call Phoenix?
No. Actually, I had a conversation with Chandler. They try to keep their unit within their city. And I asked them that specific question is, when you're out of service or it's past you don't have enough staffing to put that unit up that day, what happens? And she said the units will call the system and the system will respond, the automatic aid system will respond. So it would not limit us from any off hours calls or days that it's not staffed to be able to bring in an asset. But again, that asset's very limited. So, it's certainly something that.
But it wouldn't if we kept the area to Goodyear only until you figured out how all these is working.
Correct.
You wouldn't have any problem if for some reason you needed to call. Okay.
No.
Sherry?
I also agree with community response team. I think that's a really good, because I think our Goodyear Cares is more of a slogan or more of a umbrella for everything. Right. So I agree with that. I agree with Joe on the geo-fencing until we get the data.
Okay.
Do you want other questions now or want those later?
We were really looking for feedback on the name
I
right
will-
now,
I'll
but,
I'll pipe up later with other questions.
okay.
Brandon?
Yeah, the name's fine. Okay, I like the name. I got more questions, but I'll come back.
Any other comments? Bill?
You obviously don't have any concern with this being almost nearly the same as the CERT team.
Yeah, that certainly came up. But, I tried to project, if an officer or a firefighter was talking to a patient and they offered this as a resource, I think they would more use the community response team to come out rather than CERT. But, certainly in our field, we'd like to shorten things as much as possible, but that is a potential.
We've got, 300 or 400 community members, I think, over the last 10 years have been trained. The name is irrelevant to me, quite honestly, but I just wanted to point out that this is, minus one word, this is the CERT program. And we've got a couple hundred members in the community. I would hate for someone to walk around and say, oh, I'm a Goodyear CERT person. Well, it's that. I'm part of the community response team. And then have there be confusion on the issue. But other than that, it's irrelevant.
I like the response team.
Okay.
And referring to Bill's remarks is that CERTS is really developed too for something big that hits the city. Am I incorrect by that? As I
No,
remember,
you are
yeah.
correct.
Okay, so
Yep.
I can analyze that and place some different places. Not that you couldn't have times that you need somebody from the CERT. We don't know what the circumstances are going to be on all of these.
Right.
So there still is that ability.
Yep.
But two different reasons for it.
Sure.
So, if you have a big tornado or flood or plane crash and, F-35 plane crash, we're going to need that CERT team. That's something to do, so.
Okay.
Okay, any other comments? Okay, go ahead.
Thank you. Certainly, we've talked before about this, but some performance management standpoint, some metrics to consider. Develop and implement a primary response area reliability data. So, by geofencing, we could certainly look at what their effectiveness and efficiency is within that response area. Working with the police chief on this to reduce emergent police and fire units dispatched to behavioral health calls by 25%. Certainly is our goal to not always send an officer to that. I know Chief and I were talking earlier about the differences in some of those calls, and I don't know if you want to kind of elaborate on that, Chief.
Yeah, I'd like to take a minute and just talk about it. So there are different types of calls. Obviously, there are criminal calls that we have to go and investigate no matter how you look at it. And then there are also violent and nonviolent calls, even though there might not be a criminal aspect to it. But sometimes when it comes to mental health, I don't know that police is always the best answer, especially if it's non-criminal and nonviolent. The last thing we want to do is to get there and upset somebody and, in a sense, aggravate them more. So when the professionals do come or the fire department does come out and assist them, that now they're wound up because there's a police officer there and they automatically think that they're going to go to jail or that they're being investigated for something. So that's part of our reducing those calls for service that are there. However, we'll always be there and we'll train our dispatchers to know the difference when that initial call comes in to see if an officer needs to be dispatched or not.
I'm going to ask a question about the mental health of it. Is that coming later you'll talk about it, or is this where we should talk about it? I think, that's a real need in our city.
Yes.
So I think we have needed something.
Yeah.
And so I'm assuming this other person that's going to be writing on that is going to be well informed on mental health and.
Absolutely. Yeah.
Okay.
Yes.
All right.
Yeah. And it's, the other thing that the chief and I talked about earlier is this is different than the victim's advocate as well.
So yeah, our Victims Advocate program obviously deals with many things, especially when it comes to different crimes and so forth. It could be that person could be busy coming here to the court and helping somebody get an order of protection or injunction prohibiting harassment, or they could be on scene helping us make a death notification or something to that knowledge. So they're not always available, but it's really a different type of work. They don't have that professional medical aspect of it on how to diagnose or how to look at somebody and provide them the resources that they need to get through that crisis moment.
Any other comments before they go on? Go ahead.
Thank you, Mayor. So we would put another goal of ours or metric to measure would be put the initial response units back in service when applicable within 45 minutes of dispatch. Reduce the frequent users of the 911 system for non-emergent needs by 40%. And we've certainly demonstrated through community paramedicine and really placing the right resources for the right patient at the right time. We've seen a reduction already. I talked previously about our current program that we have with Surprise Fire Department in United Healthcare. And so far, even in 6 months, for our highest users, we've been able to reduce the use of the 911 system for non-emergent needs by 79%. And so we're having success in that and making sure that the patients get into the correct resource. And then certainly another portion of what this unit can do is community paramedicine. So visit in person or have phone contact community paramedicine identified patients within 48 hours of their initial contact with the system. So we developed a little bit of timeline. So tonight obviously is the council conversation and the work session to talk about this. On May 24th, you'll have a tentative budget adoption process that you'll work through with the finance director and the city manager. And then in June and through July, we'll work on workflow, if this is moving forward, policies and procedures. June 10th, we'll start to post the positions for the firefighter, paramedic, and the social worker job. The week of June 21st, we're proposing final interviews and then an offer. And then week of August 2nd, get those new employees in for the Goodyear orientation. And then by September 30th, complete training for PD dispatch and the officers and the firefighters. And then our go live would be by November 15th. Now, one of the things that we'll have to certainly work through is the availability of fleet resources that are out there. So difficult to get vehicles right now just because of the ordering process. But I've been working with the fleet manager and my boss and to talk about some alternatives. So we feel like there are some alternatives out there that would help us meet our goal, but certainly that's something that we would keep council informed about if we do have significant delays in ordering of vehicle. So some of the costs that would be considered as part of this program, the one time would be the $102,800, and that's for vehicle equipment, lights, radios, and then the mobile command terminal, and then which is the onboard computer. And then the ongoing cost would be the $244,800, which would be personnel, dispatch, and then benefits for those personnel. And then kind of to break it down a little bit further, salaries. So for a licensed clinical social worker, starting, well, mid-range there, about $72,000, and then with benefits, $104,200. And for the firefighter paramedic, it's $106,680, and that includes their benefits as well. So at this point, the police chief and I are here to take any feedback or any questions or further direction that you may have.
Thank you. Brandon?
No, good presentation. I appreciate the history and the timeline and yeah, all the information here. So I had a question. You said you project, or you think they're going to work 4 days, 4 10s?
Yeah, I think that would be the goal for us. Talking to some of the other programs, it's how they staff to kind of find the sweet spot for the vehicle. And most of the advice that the most experienced programs said, you know, start it with your busiest days and times of those days. to really understand the system and how the needs are for the clients. So that's what we're proposing would be 410s.
Do you see, I think utilization of them, do you see, I don't see them doing the same thing every day,
No.
I mean, all day long. Do you see them doing other things, or I guess administrative types things? What are they doing when they're not doing
Well, yeah,
that
I mean,
position?
certainly.
I mean, I hope
there's-
that there's not a huge demand, but I know there will be some demand. So.
Right. Well, certainly with our current call volumes that we're seeing, we think there is going to be decent demand for them.
Right.
Yes, there's going to be administrative portions to this. There's going to be education, them educating, them getting educated. There's going to be the community paramedicine piece as well. So calling on those patients, seeing what their needs are. And a lot of times those can be handled over the phone, but sometimes those are in-person visits that would be needed. So, there's not going to be a lot of downtime for them just because it's a new program. We want them out and about. We want them talking to the officers, talking to the firefighters, doing crew visits. So they're certainly going to be busy in their first year.
And then the other question I had is, so I know in the examples that you had, they were using a paramedic. Maybe I'm just ignorant in this, but what's the benefit of just a paramedic versus a paramedic / firefighter? I guess what more as a firefighter and paramedic can I do in this capacity?
Well, I
You can
think
do a lot. I'm just
the
not
benefit.
sure.
So the benefit for us, certainly in our system, is we have a large resource of firefighter paramedics that currently work. We know who they are. They're established in the city. They know their resources. They know how workflow works within the system. And they have that skill set, because we would not be looking for somebody that's fresh out of school or maybe this is their first job. So these are going to be experienced, 3 to 5 year personnel within our department. Hopefully that some of our community medic trained paramedics may be interested in this position. That we know it's a stable workforce for us. They have knowledge of the patients already, a lot of the patients that they already see. So we feel like that gives us kind of the best foot forward to make this program the most successful. And I will say, after we did our first pilot with Peoria and Surprise in Avondale for community paramedicine, as we were ending, we sought feedback from those medics. And in that program, we trained close to 30 medics, firefighter paramedics. And the biggest and most consistent feedback that they gave us is that they thought the best crew makeup would be a social worker and a medic, because it really they can handle most situations. So kind of based on that feedback, and then also based on other models that are out there, that we felt like that was the best crew makeup.
Okay. Yeah. No, thank you. Just had some questions. Thank you.
Any other questions? Sherry?
I have a question and then a comment. Is this going to be branded under fire? The fire logo will be on the van? Is that
We're going to have the city logo
Okay.
on there. So probably similar. We were thinking about the city Goodyear with the heart
Okay.
on it, that logo. So yeah.
people know it's from the city and that.
Correct.
I am a big fan. I don't know if you're trying to maybe bite off too much with this. I think we're going to find that the volume of work is going to maybe exceed, and that'll be interesting to get the statistics, adding the community paramedicine. But I think it's a great start, and I'm glad you're going forward. I've been a supporter of this since the first time it came around, because of the support it can give. I've spoken before about the young lady at our office who passed away, and we had to get the community response van from Phoenix.
Right.
And then I was thinking of my own experiences when my mom passed away. The fire department was wonderful with my dad, who's 83. But then I talked to my daughter, who was like 13 at the time, and she's like, she still remembers the last time she saw her grandma go away was in the fire department van.
Yeah.
So something like this would have been great for my family.
Sure.
Just as a personal. And I did domestic violence prosecution for 13 years. And Chris
Yeah.
Parks used to run the program there. And
Yep.
this is in the 2000s. And not only does this help victim safety, because the victims advocates aren't trained in the social work, it also
that's true.
helps prosecution. that because the victims feel safe. And when a victim feels safe, they will come forward and they will get the help. They will get the orders of protection with the victim advocate. They'll be more open to the police because they've talked to the social worker and the people that talk to them. And nothing against the police, but the chief hit it right on the head. When the police come, sometimes it aggravates a situation, whereas services and help and those inner services can really help people. So I think this is a great program. I'm glad you're adding in the paramedicine. I would like to know, though, if it becomes too much, because I think that's something that we do have to look at to make sure that we don't try to have them do too much, even if it's mid-year, if we're seeing this. I guess it's going to take about a year to get it started.
Yeah.
So, yeah, but I think it's a great program. You have my full support, both of you. I think it's great. And I think with everything going down with public safety, this is an integral part of public safety in this modern age. And I think we need that for our citizens with all the mental health issues. So thank you.
Laura?
I want to thank you for the amount of research that you've done for this and that you've made it relevant to both police and fire to serve the needs of the community. And unfortunately, crisis is really becoming the new normal. And I think even before the pandemic, we were seeing mental health and behavioral health more frequently. And then I think it's just even accelerated since then as it happens. And as we know, they can be volatile, potentially litigious. And I think this is a very practical, community-centered approach to dealing with the human condition. I mean, people under high stress, there's a lot of just a lot of trauma going around, and I think that this is a great way to go. I'm curious if you've developed resources for, because essentially your social worker will do some sort of triage and then will have to refer. And do you have a network of places to send people to?
Yeah, so we've developed a lot of those resources with community paramedicine. We've built a pretty robust list, and it continues to grow as we need different things. And you may have seen in the manager's memo on Friday, we needed ramps built for a couple of our patients, and so one of our captains was resourceful and found a resource within Pebble Creek, and they were able to build the ramps for free. So, certainly the social worker that we're going to bring in is, again, not going to be somebody that just graduated from school. We're going to look for somebody that's been established in their field and hope that they would bring a group of resources in. But we've certainly built a network, and we'll continue to build that network.
Great. Well, I think this would be a great asset for the community and also be a great asset for our sworn public safety. So I'm very supportive of this.
Thank you.
Joe?
Yeah, I kind of like the idea. I know there's probably a demand out there, but the question I have is, just mental health is a big issue now, okay? And to be honest with you, I think that's what's probably driving a lot of the violence that's going on out there, if you can catch that early on. How would that work for this response team if, for example, what kind of contacts do you have on the outside? If you run across an individual as a result is really unstable and probably shouldn't be out there, do you have referrals where you can get that, whether it's to the police or whatever the case may be? Because I really believe a lot of the violence out there, if they could have identified some of these individuals early on, may have prevented some of that violence from happening. And you may be able to catch that firsthand on some of these calls you may run across.
Yeah, I don't know if you want to talk about the crisis intervention training that your officers go through.
Yeah, so our officers do have the ability, one, to refer people, also to work with families in case it's juvenile, because we work with those families to get their loved ones referred. Our officers are trained in, not all of them yet, but for the most part, half of our officers and a portion of our dispatchers are also trained in the 40-hour crisis intervention training that is known nationally. And they do use that. And but also on the public safety side, on the fire side, the referrals are there. We have the businesses that we can take people and get them referred to get additional help for either 48-hour, 72-hour holds to get them to that thing, or to the location where they can get that professional help. We would always do the transports if we need to. Obviously, we don't want anybody to get hurt or anything to that nature if it's needed. But for the most part, The follow-up is the big thing. Officers are so busy that many times they don't have the ability to go back and follow up. And I think that that's where the CR crisis response team, like you said, Brandon, on any free time that they have, is they should be able to follow up and see what happened. And hopefully we're not back there at a crisis moment again, trying to deal with somebody.
In a lot of these calls, talking to and doing the research on this program, a lot of these calls are very slow, right? And so when the social worker, they're working in a patient that's in crisis, it's a very slow process. They're not going to try to rush them into making decisions, going to take it at their pace. And in talking with two of the social workers last week, that was the biggest thing. They kept pushing back on me to say, these are not kind of 10 minutes with the patient and then we're going back in service. Sometimes these calls are 2 to 3 hours long because they're trying to find the right resource, but they're also taking it at the patient's pace. So it's a much different approach. It's a much more slowed down process. So we're going to make sure that we're de-escalating those calls, making sure everybody's safe, and then we're getting the patient where the correct resource is for them.
I appreciate the feedback. Thank you.
Bill?
Chief, on the one slide you talked about geofencing, but only for the first year.
Yeah, we would certainly want the feedback from council. You know, we provide the data for you guys and really have that conversation about, you know, should we open this up? Should we expand it more? But I mean, and certainly that's the city's decision. And it's not something that the system has to drive. So we can certainly geofence it for that first year and really understand what the services are or the needs are within the city of Goodyear, and then determine at that point if we want to expand it.
So when we talked about this during the budget presentation, it sounded pretty clear that the majority of the council felt that this should be geofenced, period. So now if we're talking about bringing this back, is this how do we envision this happening? Are we doing this every year during budget season? I mean, what's the anticipated view of that? Because council was pretty firm, I thought.
Certainly we could come back with a conversation. I don't know if it's every budget year, but I think if next year we come back with the data and the council decides that they want to keep it only in the city of Goodyear, I think that's pretty much a permanent decision at that point. So I don't envision it coming back every year for conversation.
So after year one, come back, revisit, and then
Right.
make a decision, and that becomes gospel. Okay, thanks.
Well, I think you're going in the right direction because I always think about the word need. And it's something we have needed. And the other thing that it always concerns me is whenever there's trauma, there's confusion. And by having that social worker, being able to give suggestions and direction for them, because so many times just leave them in that state, especially the surrounding family, and they really know nowhere to turn to. Right. They don't know who to call, and that's natural. I understand that if you haven't been involved in that side of the family. So I just think this is going to be a great program, and I think it'll be the idea that you're going to come back and report and be very clear with the council on the cost and the worth of that cost and how it's worked out. But I know you're very good at that, so we look forward to the next time we meet with you. Anything else you want to say before we close this? All right.
I
Thank you.
appreciate the conversation tonight.
Yeah. Thank you for the great report.
Thank you, everyone.
All right, the time is 5:38, and so we're going to have a break until the 6 o'clock meeting. So no further business. This meeting is adjourned.